Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and I'm here for another one of my live Q&A sessions that I have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys live and your chance to answer any questions you have for me live. And of course, because I'm without my producer, I have forgotten something. So 1 second. And this is why we have producers. So, hi, I'm Dr. Samantha, the maternity mentor. Welcome back to another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys live, as well as your chance to ask me any questions that you want to and get your answers to the questions that you have submitted over on the channel. Remember, we're on Facebook and Instagram for additional content, so please feel free to check us out over there. And if we're trying to put out new videos every week, so I know we have another good one coming out tomorrow. So I'm going to jump right into some of the questions that we had this week because we had some good ones. But if you guys have any questions, please put them into the chat. And I'm checking a double screen here. So I wanted to start with this question that we got on my incompetent cervix video. So it said, hi, I want to share my story. I don't have any children, but I have had 3 miscarriages, and I don't know what's wrong with my body. My first pregnancy started with my water breaking, and the doctor told me I was having a miscarriage at 12 weeks. A year later, I had become pregnant again, but I lost the baby at 13 weeks. After that, I went to the hospital for tests and they didn't find anything wrong. I got pregnant again, and this time it was twins. I went to the hospital every week. At 12 weeks, I started bleeding and went back to the hospital. They checked me and said my cervix was open, meaning that I was going to have another miscarriage. I had to accept the situation. The next day, the doctor checked me again and said that my cervix had closed, so they sent me home. A week later, I had a miscarriage of one of the babies. I returned to the hospital, and then I had a miscarriage for the second baby. Now I'm scared to get pregnant again because I don't know why this keeps happening. Can you help me? And please reply. So I want to thank this viewer for being brave enough to share this story, because this is such a vulnerable place to be, to share your experience with loss. Loss is extremely traumatic, and it's one of the biggest fears that people have when they're pregnant. This is why my bleeding during pregnancy video has so many likes and so many questions, because the number one thing when we get pregnant is protecting the baby. This is why people question whether they should use medications or use vaccines and the whole like. So for this question, a lot of people want to know the why. And unfortunately, there's not an easy answer to that. What we know right now is that miscarriage is extremely common. There are people who tend to have more miscarriages than not, and some of that is understood when certain testing is done, and some of it is not understood. If you've had repeated miscarriages, you need to go and speak with a reproductive doctor who specializes in genetic testing and infertility, because these doctors can go ahead and can test to see if you and your partner together have some kind of genetic mutation that would be incompatible with life. So there are things that when we get pregnant, the babies can inherit that they would not be able to survive out of the belly. And these are what we call incompatible with life. An example could be a baby that didn't have lungs. So a baby could be conceived and have a heartbeat and everything, but not have fully formed lungs. And so once leaving the body, they would not be able to breathe, and that is not sustainable for life. When we have conceived babies that have these abnormalities, these genetic abnormalities, the body can sense that and will sometimes produce And I apologize if this is a little sensitive, but the body will produce a miscarriage. And the body does this to protect the life of the woman, because in order for us to have more babies, we need to be alive. So if the body can sense a pregnancy that's not going to result in a live birth, it may do that. Other reasons can be neural tube defects, issues with the development of the brain and the spine. We know that those are often linked to folic acid ingestion and taking the right amounts of folic acid. So if you aren't getting that in your diet, you may end up with a birth defect, and the body senses that, and then you might have a miscarriage. If somebody's had more than one miscarriage, one of the things you think about is what is part of their lifestyle could be an issue. So genetics or genetic abnormalities between the woman and her partner. Also, you could have the idea that you're not absorbing folic acid. That brings up whether you might have MTHFR genetic mutation. MTHFR genetic mutation is a mutation that causes you to have trouble processing folic acid. Now, let me just be clear. You still have to take regular folic acid if you have MTHFR. You just would take both. And in fact, that's because the regular folic acid is the only folic acid that's been studied for like safety for pregnancy and the prevention of neural tube defects. And then you could also have an infection. There are infections that we can get in the vaginal area that go silent. They're silent infections. And if left untreated, they can lead to a lot of different issues. But ultimately, unfortunately, there's no way to say for sure what happened. If you've had an incompetent cervix, you may you're at a higher chance of having another incompetent cervix. It's not a guarantee. It's just a possibility. But your water can break without having an incompetent cervix. So the problem is once the water breaks, it releases certain chemicals that will then cause the cervix to dilate, because the water breaks, releasing hormones that say, hey, it's time to deliver a baby. But your water can actually break due to infection. That's one very common cause of water breaking. That's why I'm always telling you guys who ask the questions about taking medications like antibiotics, you need to take it to its full completion, because if you don't get rid of the infection, you can end up having a miscarriage. So unfortunately, it's really, really, really complicated, and there's no way to say for sure what caused it. What I will tell you is another big thing that I see as an issue is supplements. So many people take supplements that are not safe for pregnancy, and they don't realize it. So if you are of childbearing age and you are not preventing pregnancy, you need to stop all of your herbal supplements and teas until you can speak to a professional like myself who can tell you which is safe for pregnancy and which is not. Your OB-GYN or midwife should also be able to do the same thing. The second thing is essential oils. Guys, essential oils should not be used lightly, okay? These are very serious chemicals. So I have a certification in alternative medicine, and I am very, very, very big into like essential oils are awesome. I will never tell people exactly how much to use or what to use, because I am not certified in that. Believe it or not, you can get a certification in essential oils and like the prescription of essential oils. Essential oils can be highly toxic. So you can actually end up with a lot of serious issues if you don't know how to handle them. And they can be toxic for babies. So some essential oils have been associated with miscarriage. You do not want to just be handling essential oils if you are trying to get pregnant or you are pregnant. So those are another example of something that we have to be careful of. So when you're talking about miscarriage, these are some of the things you need to take into account. Hey, Phoenix, what are the best natural remedies for anxiety? Okay. I love this question, so thank you for asking. So the number one remedy for anxiety is to correct your sleep-wake pattern, your circadian rhythm. I know that may sound like a cop-out answer, but guys, if I ever have a TED Talk, it's going to be on how we're cavemen and how everything in our body works on everything that we were about in caves. And it starts with light. light is the number one thing that drives mood. A lot of people, when they're stressed out and they go to the doctor, they'll want their cortisol level checked. And they'll say, like, I know I'm stressed out and I know my cortisol level's high because of this, this, and this. And the thing is that cortisol levels might be high, but the reason why your cortisol level is high and why stress has affected it has to do with the relationship of that stress and light. Light starts our bodies. That's what tells us as human beings to get up. And the cortisol levels reflect a diurnal pattern of day and night, light and dark. And so your cortisol levels get out of whack when you are stressed out, and when you're not, they are peaking and troughing at the right times. So sleep becomes your number one, and wake is right there with sleep. Because if you are getting bright light in the morning and you're waking up early, that starts to reset that rhythm. When you do that, you lower stuff like cortisol, which is a stress hormone, which can help to increase anxiety. When we talk about actual swallowing like pills, so the first thing you got to remember is if you are trying to get pregnant or you are breastfeeding, most natural supplements can't be used. Now, it's not because I don't believe that they're safe. They probably are safe, but the problem is they're not studied, there's no data, and they are not regulated by the FDA. The FDA isn't going in and checking ingredients and checking quality and seeing if these things are good or if there's any kind of contamination. They're not doing any of that. So what you need to do is you need to stick to tried and true supplements, which limits a lot. Magnesium is one of my favorites. Now, if you look around, you're going to find that there's a whole bunch of different magnesiums. The best one is glycinate. Magnesium citrate can actually cause stomach upset, and it can actually cause diarrhea. So magnesium glycinate is the best one. You can also find that can help with like preterm labor sometimes, but it's not a treatment for preterm labor. Magnesium can help you sleep. It's a smooth muscle relaxant, stuff like that. I tend to avoid the teas. I normally would say chamomile tea or something like that. But if you do want to use the tea, guys, again, you want to go for big brands. So believe it or not, something like Lipton tea is far safer than something like, I don't know, this company from a hole in the wall, and they sell one box a year. Lipton is being drank by millions of people, and people are okay. So you can kind of make an assumption that it's safer than not. So I hope that helps, Phoenix. I know it's kind of a little bit of a cop-out answer, but it's really very hard during pregnancy and postpartum to take a lot of supplements, but there's tons out there if you're not. Hello, doctor. My sister tested positive for strep B at 18 weeks. They gave her a shot of Rocephin, and they plan on putting her on antibiotics the day her water will break, but she doesn't want to. Is there a chance she can reduce? Is there something she can reduce? Is there something she can do to reduce the chance of passing it on to the baby at birth? And she doesn't understand why she got tested so early. Okay, Edith, I love this question. So this is a great question. So GBS, Group B strep. And I actually have another question that came in on the videos, which on my Group Beta strep video, my GBS video, which said, why does a baby have a risk for late onset GBS if the mother was given, if the mother was given antibiotics through an IV during labor? So why would a baby get GBS if mom got antibiotics? Okay. So GBS, Group Beta strep, is a bacteria, okay? It is a bacteria that is found in the vagina and the anus naturally. Not all people have it, and you can have it for one pregnancy and not another. And then, Edith, kind of going into your question, you can test positive for it at one point in time and then negative later on. Okay, so this is a bacteria that's coming and going. It's not sexually transmitted. It's just there. It just is. However, Group Beta strep infection in a baby can be deadly. It can kill babies within 24 hours of birth. It is a very, very, very big deal. Now, if you have Group Beta strep and you'll go untreated. You do not receive antibiotics. It does not guarantee that your baby is going to get that infection. That is not what that is. But your baby will be at a much higher risk. Now, as far as why was your sister tested to begin with? My guess is at 18 weeks, something was going on. If she had gone in with any kind of contractions, any kind of complications, bleeding, spotting, anything, they might have tested her to see what was going on. And if they found group beta strep can cause labor. Any infection can cause labor. They might have felt like they needed to treat that, and then she was going to get better. So they give her the antibiotics and it should go away. Now, they might have also found it in her urine. You can find GBS in urine. So that's another way that people will get treated. So great. They wanted to make sure they got rid of the group beta strep at that point. Most women are then tested again around, I want to say it's 37 weeks of pregnancy. It's very, very late in the game because remember, I told you guys, you can test negative and then be positive. You can test positive and then be negative. It like changes. So we try to do it as close to the end as possible because that's going to like hopefully help give us an accurate answer. So I'm not sure why they're telling her that she's going to guaranteed get antibiotics. That doesn't make sense to me. I've never seen it just like auto done. I've always seen them retest again. And then if the test is positive, then they treat. Now, what happens is if a mom does not receive antibiotics, at least where I'm at and where we practice in Florida, that baby is then monitored for a GBS infection. They're usually kept in the hospital for a minimum of 3 days, and they're sometimes kept as long as 10 days, and they receive antibiotics if they're kept for the full 10 days. Blood work is drawn to see if the baby may have developed the infection. We know without a shadow of a doubt, a baby that develops GBS infection is at a high risk for death. So we need to make sure that that baby is monitored because a baby who develops a GBS infection at first will just seem like a very sleepy baby. This will be a baby that eats, but not a lot. This baby will be very sleepy and tired. And the thing is that these babies, they don't crash until they crash. And when they crash and burn, you have almost no time left. But up until that point, they don't have infections. They don't have a fever. They don't have a lot of obvious symptoms that tells you that they're suffering from this infection, which is why we monitor their blood so carefully. So as going back to the things, there's no way for her to reduce the chance of her getting it. And let me be clear, guys, again, with bacterial infections, it's cut and dry. Antibiotics, that's it. There are no natural treatments. There's no nothing else. I hold certifications in alternative medicine. I believe in alternative medicine. When you are pregnant, you do not have the chance to mess around. You get this one-time shot, and we don't know for sure all these other treatments. But what we do know is antibiotics work. So what do? We treat it. Now, I would tell you she should definitely get tested again. She can definitely ask the questions. She has the right to refuse medication. Absolutely. That may, and she should be asking her OB-GYN this. If you are pregnant with unknown GBS or a GBS positive and you refuse antibiotics, which is your right? You need to understand your baby will most likely be held in the hospital for a full 10 days in an ICU. That is for the baby's safety. So before you decline a medication, you need to understand what that means for the baby. And so I want to make that very clear, not as a threat. You still have every right to say no, but you should understand the full scope of your decision because some women aren't told that. And then they've given birth and all of a sudden they're told, oh, well, the baby's going to have to stay for 10 days. And they never knew that. And they might have changed their decision had they known that. So make sure she has that conversation. As far as why would a baby get late GBS infection if the mom got antibiotics? Ultimately, If it's a GBS treatment resistant infection, that could be a reason why you're going to end up with a baby who has GBS infection, even if you got antibiotics. It could be that the baby was born too quickly. The antibiotics are going in IV. Generally speaking, we don't consider them to be adequately covered unless the mom has had 2 doses of antibiotics, 2, and those have to be 4 hours apart. So that's a long time. You're talking you need about 5 hours of labor time in order to properly treat a mom for a GBS infection. So it's possible that she came in, she had GBS, the first bag of IV antibiotics was going when she delivered. That's not going to hit the baby. That could be why. So I hope that helped. For those of you who are joining me, please feel free to put your questions into the chat. I have a question on my aspirin video, and it said, would you recommend taking baby aspirin between the weeks 6 and 8 if I've had a previous pregnancy loss? I was taking it but started bleeding during week 6. When I stopped taking it, the bleeding stopped. Do you know why this might have happened? So this is a great question. It used to be back in the day. You're so welcome, Edith. And you're welcome, Phoenix. So it used to be back in the day that we would give women aspirin for when they had like recurrent pregnancy loss. The thought process was that maybe part of the reason why a woman had a miscarriage was due to microclots in the placenta, that these clots had caused the placenta to not work. If a placenta stops working, then a baby is going to pass away. So the placenta is an organ that develops, and it attaches to the uterine wall, and it creates this bed of blood vessels that transports nutrients and oxygen and stuff back and forth. So if you have a whole bunch of clots in all these blood vessels, clots are like little tiny balls of blood that block the blood vessel, right? If you have a whole bunch of clots in that placenta, it's not going to work right. And then if it doesn't work right, then everything goes downhill. So that was the thought process. And why would aspirin even work? Because aspirin is a blood thinner. So imagine if you took, I'm trying to think of something. Imagine if you took syrup, like maple syrup, and you added hot water to it slowly. And if you can think about it, it would thin out. It would get much thinner, closer to water, like a brown water, right? So that's kind of what aspirin does. Aspirin thins it out and makes it like a little bit easier to move. And what aspirin does is it also helps to prevent clots. That's why we give it to people at high risk for like heart attacks and different things. So the aspirin as a blood thinner, it's going to also predispose you to bleeding more. You're going to be actually at a higher risk for nosebleeds and gum bleeding and all sorts of other stuff, which explains why you were bleeding while on it. And then as soon as you stopped bleeding. It thinned out the blood vessels. It thinned out the blood, and the blood vessels in the vagina were probably very sensitive, and they burst and you were bleeding. Would I recommend it? As of what the guidelines are right now on a piece of paper, no, I would not recommend it. Let me be clear, guys. If you have been recommended to take aspirin, don't just stop because I said so. You need to have a conversation with your doctor. There are reasons to take aspirin that we know of for preeclampsia. I have a whole video on it. You can check it out. It's usually done a little bit later than 6 to 8 weeks, but it's definitely there. So you can check it out and see what you think about that. So that's one thing. The other thing is that maybe there's other reasons why you might need to take it. So for example, there's a couple cardiac, conditions where your heart is beating wrong. You have like a different type of heart rhythm, and then because it's not normal, it's called an arrhythmia because it's an abnormal rhythm. And we get worried about blood clots for those. And since pregnancy is a high risk for clotting, some pregnant women will be told to take baby aspirin for something like that. So you need to really understand also, why were they telling you to take it? But the data as far as taking it for recurrent pregnancy loss is no longer, it's no longer there. So you want to ask why your provider is thinking that. I have a person who commented on my cholesterol video, and it said, I'm 6 months pregnant and I have a cholesterol level of 400. Is this normal? Should I be concerned? What should I do? So this was a hard question to answer because there's different forms of cholesterol. There's not just one form of cholesterol, but 400 is super high, right? Now, as far as what would you do, this is complicated. So I have a cholesterol video, a high cholesterol video. Please check it out. There are certain medications that you can take for cholesterol. One of the most common ones are statins. Statins can be used during pregnancy. I'm on the fence about statins, guys. They have positives and they have negatives. But statins, like most other medications, take a little while to get going. And so it's not something that, like, if you took a statin cholesterol medication today, tomorrow your cholesterol is back to normal. It's not how it works. And then as far as like changing your diet and those effects on your cholesterol, it'll work, but it's not going to be overnight. So this is tricky when you're at 6 months pregnant. Many women who have high cholesterol going into a pregnancy will maintain their medication. That's something that can happen and often does happen. But other women who are developing cholesterol issues in the middle, or it's being discovered, this is complicated. What you need to do is you need to see a maternal fetal medicine specialist to have them evaluate your risk and check you out. You also need to be seen by a cardiologist. So we give statins to reduce cholesterol because what cholesterol can do is it can build up plaques in our blood vessels. Okay. So a blood vessel is just a tube, right? And the inside this, the cholesterol, what happens is when you guys have inflammation, so imagine that your blood vessels are a smooth tube, right? But with inflammation, what happens to the inside of the blood vessels is it's like they get jagged. So the edges are not smooth, they're rough. And then cholesterol is kind of like little bits of fat. And because you have these rough edges, the cholesterol can kind of come down the pike and it gets stuck. It gets caught onto one of these edges. And what starts to happen is instead of a smooth wall, you end up with these bubbles, okay? And these bubbles start taking up some of the space in here. And what happens is your blood vessels get narrower. The narrower your blood vessels get, the less the blood can go through and the higher your blood pressure is. Your blood pressure gets higher because the heart has to push it through smaller and smaller spaces, right? It has to work even harder. That's why high cholesterol starts this cascade that leads into like a lot of heart disease. Okay, so when you're pregnant, you're carrying twice the volume of like fluids. Your heart is working way overboard. It's like a lot. So if you've got this amount of cholesterol, you need to be seen by like a cardiologist, a heart specialist, to really evaluate your cardiac health. Because if you have a whole bunch of blocked blood vessels or almost blocked blood vessels, that's going to put you at a higher risk for a stroke. So a stroke can happen for two different reasons. Strokes happen because one, a blood vessel bursts. That's called a hemorrhagic stroke. And that's where you just bleed out in the brain. Or two, you throw a blood clot. So that means a little piece of blood comes off of the blood vessel and it hits like parts of the brain and blocks a blood vessel in the brain, which causes the stroke. So you're at a higher risk for this when you're pregnant if you have a lot of cardiac disease because you're at a high risk for clotting anyway. So somebody with a cholesterol of 400, you need to see a cardiologist and a maternal fetal medicine specialist immediately to evaluate your risk. At 6 months pregnant, it's hard to say whether they would put you onto medication or not. For those of you who are joining, welcome, welcome. Please feel free to put your questions into the chat. I had a question on my preterm labor video, and it said, I'm 28 weeks pregnant. My stomach feels hard and tight. Is this normal? Please help. Guys, if your stomach feels hard and tight and you're in pain, please go to the hospital or call your healthcare provider. Okay. I am saying this not because this person did anything wrong by asking. I'm so grateful when you guys ask. please call your provider when you're in pain or you're bleeding. And that's why I brought this question up. A lot of people are very scared to call their providers. Um, Providers can be very intimidating. They can be very short. A lot of people will say that they call their OB-GYN in the middle of the night and the OB-GYN is annoyed with them. Guys, they get paid tons of money to be on call 24/7. They get people to cover them if they don't want to work. You need to call them if something's going on or you need to go to the hospital. Because at 28 weeks, this particular viewer is 28 weeks pregnant. That baby, if you get to the hospital and you're in preterm birth, if you're in a hospital that can take care of a 28-week baby, we can save that baby. But a 28-week baby being born at home because mom didn't get to the hospital in time can be very dangerous for that same baby. So you want to make sure that you are seeking out healthcare when you need it. But if you're feeling pain, it needs to be checked out, okay? Any pain needs to be checked out because you don't know what's going on. And there's a lot of things that change with your body. All right. I had a question on my swelling video. I'm 8 months pregnant and my feet are very swollen. What can I do? So for starters, one of the most important things that everybody should know is if you are experiencing increased swelling, you need to make sure you're calling your healthcare provider so that they can give you guidance on what to do. And you need to be monitoring your blood pressure. Guys, one of the symptoms of preeclampsia, which can be a life-threatening condition, is swelling. The two other symptoms are visual changes, and this can be any kind of visual changes. So it can be stars, it can be floaters, which are things that seem to be floating in your visual field. It could be like tunnel vision, blurry vision. Eyes can feel heavy. Like a lot of people will be like, oh my God, my eyes are so heavy. They feel so big. That's another sign. And then you can get these headaches that just won't go away and they're weird. These are all signs of preeclampsia, and swelling can go along with that. So like swelling, the first thing you think of is that. But some people just swell. So what can you do? What would you do if you sprained your ankle? So if you sprained your ankle and you twisted it and it got really swollen, right? You would probably sit and you would put your feet up. You would elevate it. That's what you want to do if you have swelling in your feet and your legs from pregnancy. You want to make sure that you're sitting and putting your feet up a lot. The more your feet are hanging down, the more the swelling is going to take place. You want to use compression stockings, which are the stockings that help to return fluid up towards the heart. Now, as much as you want to be sitting with your feet up, you also want to be walking. Walking is one of the ways that our body squeezes the muscles to help get the fluid back to the heart, which is how we get it around and out of our system. So those are like the three main things, but then you also just want to keep an eye on your blood pressure. Okay. Guys, if you have any questions, please feel free to put them into the chat because I only have one more question on my side. So I am 9 weeks pregnant and I am taking lamotrigine. I feel very depressed. My heart just goes out to this person because it is extremely hard to be pregnant. It's extremely hard to be pregnant for a variety of reasons. If you don't have the right support, if you are not feeling good due to the pregnancy itself, if you've got any number of things, it can be hard. Lamotrigine is a medication that's used for mood stabilization. It's an extremely effective medication. It's one of my favorites. Fortunately, lamotrigine is also looking like it's one of the safer mood stabilizers that are available on the market. So it's one of the ones that we try to reach for a pregnant person when we want to use a mood stabilizer, because it's something that it appears to be from the data to be safe for pregnancy. If you're on lamotrigine, somebody is prescribing it to you. So the first thing you want to do is you want to get to that doctor so they can look at your prescription and possibly adjust it. Pregnancy is a time of change. You're growing a human being, which means many of the medications that you take may need to be adjusted. A great example is thyroid medication. Thyroid medication, very routinely, you need to have your thyroid checked over and over and over again during your pregnancy. And the medication sometimes has to be adjusted even weekly because your body's just forever changing in this, right? So what you want to do is you want to go ahead and you want to get to your doctor to see what's going on. You also want to make sure you're not anemic. Anemia is a very big cause of brain fog. It can cause concentration issues, attention issues. It can cause an increased heart rate, anxiety, and depression. So you want to make sure that you're being checked out for anemia, which is very common during pregnancy. So my biggest takeaway with this is that the lamotrigine might need to be optimized, and that's it. There are other medications that are safe for pregnancy that you can take for depression. And of course, we want to make sure that you're healthy. It is essential that you treat your mood disorder. If any of you guys are suffering from a mood disorder, or you know somebody who's suffering and they are pregnant, please tell them to receive help. The data is clear. You are at a higher risk for having a miscarriage from untreated anxiety or depression than you are from taking many of the SSRIs or the other medications that are used for mood. And there's so many wonderful medications out there. Additionally, it's okay if you don't want to take meds. If you're safe, some people just aren't comfortable. So then we look at alternatives. Phoenix was looking for some of the natural alternatives. And one of the other number one evidence-based things is therapy. Therapy is a fantastic outlet. It's a place for you to vent sometimes. It's a place for you to talk through some of your stressors and your anxieties, and for you to develop coping skills and other things that can help you to, manage your mood and to feel better. So I hope that helps. So that was the end of all of my questions. So seriously, guys, if you guys have any questions, you need to put them into the chat. Remember, we're over on Facebook and Instagram for additional content. Please like and subscribe to the video and to the channel, and you can get hit the notification bell to get notified of our latest content. We have a great video coming out for you guys tomorrow that I think you'll love. This is a video on pregnancy insomnia. So I feel like very big on talking about insomnia because insomnia is so important and sleep is so important. And so it's very important for you guys to get good sleep, and this will give you all the tips and tricks. Why do I feel dizzy while eating? Is this common during pregnancy? It can be common during pregnancy. This is a good question. If you are eating too late, my guess is your blood sugar was already dropping when you started eating. That would be my number one thought for that, is that your hunger signal and then getting the actual food. Some people get hungry well before their blood sugar is dropping, right? But we get hungry because our body's saying, hey, I need calories so that I can keep working. And if people who do intermittent fasting, what happens is when you don't eat, your body pulls from the fat and turns that into sugar, carbohydrates, for us to survive. Ultimately, we basically use carbohydrates, but we need protein and fat as well. It's complicated, but our bloodstream usually is looking for carbs, right? Some people, their signal comes way too late and their blood sugar is already plummeting by the time that you're going to eat, and that you'll get some of the other symptoms. Another symptom, and I don't know if you have this, is sweating. So if you're also feeling sweaty, like clammy and stuff like that when you're eating with this dizzy feeling, my guess is it's low blood sugar. Now, is this common during pregnancy? Low blood sugar is absolutely common during pregnancy. Now, the other thing is, guys, a lot of people don't realize this. A lot of people will feel hungry. Our body will send a signal that makes it think we're hungry when what we actually are is thirsty. So thirst will trigger a hunger response. But if you're too dehydrated, you can get dizzy. So that's number 2. The last one is obscure. Okay. Your inner ear is a major part of how you stay balanced, okay? Inner ear issues can cause vertigo and dizziness. And so that's why when somebody has vertigo, they want them to go to an ear, nose, and throat ENT to have their ears looked at. One of the things that can cause your ear to be out of balance, of course, it could be because you're sick or allergies. But again, sick or allergies is because everything here gets congested with fluid. Okay. If you have high blood pressure during pregnancy and you're swelling because of that high blood pressure, that extra fluid can go a couple different places. One of the places it goes is to your wrists, which is why a lot of people will get carpal tunnel syndrome. And I have a video on that. So this area gets swollen and it compresses the carpal tunnel nerve. Another place that extra fluid can go is into the ears. And then what happens is this creates like an imbalance. Now, going to eating, if you have a whole bunch of fluid in this area and you're kind of like off, the chewing motion and possibly even the motions of like getting food and stuff might cause you to start to get dizzy. Very obscure, not going to be the most common. I think it's hypoglycemia or low blood sugar. So I hope that helped. Any other questions before I let you guys go? I'm very excited you guys are all here. I do plan to be here next Monday at 9 p.m. Eastern Standard Time. I love being able to be with you guys live. So, going once, going twice. My name is Dr. Samantha. I am the maternity mentor. I'm grateful to see you guys, and I look forward to seeing you next week. I'm going to end it for now. Bye, guys.